Hello, I am Dr. Richa Katiyar, Director at Hope Fertility, New Delhi, India. And today we will be discussing the effect of fibroids on the uterus and its subsequent effects on a pregnancy. The first myth which I want to dispel right in the beginning of this video is that fibroids can be cancerous. Fibroids do not cause cancer and they are not cancerous, but they have a nuisance value in the body. There are three types of fibroids. First type of fibroids are those which are present inside the cavity of the uterus. So the uterus has a wall, and inside the wall there is space which is called the cavity of the uterus, and in the cavity of the uterus is the place where the baby has to grow. If there is already something inside the cavity, it is obvious that there is no place for a pregnancy. So all submucous fibroids have to be removed by surgery before planning a pregnancy. How is this surgery done? The surgery for a submucous fibroid is very straightforward. There is natural access to the inside of the uterus through the vagina. The name of the surgery is a hysteroscopic polypectomy. So a hysteroscope, which is like a telescope, is introduced under general anesthesia from the vagina into the uterus, and then the fibroid is removed, and of course it is sent for biopsy. Normally a surgery for a fibroid which is inside the uterus is a daycare surgery. A patient is admitted in the morning and discharged by evening, and the patient feels as right as rain from the very next day. So all fibroids which are inside the uterus will need to be removed before planning a pregnancy. Fibroids are those which are present in the wall of the uterus. These are called intramural fibroids. All intramural fibroids need not be removed. Only those intramural fibroids, which means fibroids which are present in the wall of the uterus, will need to be removed if they are distorting the cavity of the uterus. If the space inside the uterus, which is a very sacrosanct space, is not maintained, but there is a fibroid which is causing a push mechanism and is causing the wall to bulge inwards, then the fibroid will need to be removed. So all fibroids which are in the wall of the uterus, the intramural fibroids, will need to be removed if they are indenting the cavity of the uterus, and the surgery for this is called a laparoscopic myomectomy, which means the fibroids can be removed by a laparoscopy or a keyhole or a laser surgery. I will elaborate upon laparoscopic surgery in my next video. The third type of fibroids are called subserosal fibroids, which means fibroids which are growing from the wall of the uterus to the outside. So these fibroids are the ones which are the best type of fibroids to have if there is a choice in having fibroids, because they are not distorting the cavity at all. Normally we try not to remove any subseral fibroids because any unnecessary surgery on the human body and especially on the uterus must be avoided. But there are some indications for removal of these fibroids also. And the first is if the fibroid is very large. So if the fibroid is very large, then it is sucking a lot of blood from the uterus. And during pregnancy, it may grow larger, undergo torsion, or undergo some kind of degeneration. So fibroids which are more than 5 centimeters in diameter, we may consider removing them. The second type of subserosal fibroids which we would like to remove are those which are causing pressure effects on the neighboring organs. So if the fibroid is pressing upon the ureter and causing a blockage of the flow of urine, or if it is pressing too much upon the urinary bladder and causing urinary symptoms, or if it is pressing backwards upon the rectum and causing constipation or a constant feeling of the desire for defecation, then these fibroids may also be removed. The way to remove subserosal fibroids is also by a laparoscopy. So to revise, all submucosal fibroids have to be removed. Intramural fibroids may be removed if they are very large or they are distorting the cavity. Subserosal fibroids may be removed if they are very large or they are causing pressure changes on the neighboring organs.